Moving ahead with the 7th edition of Rasashastra Sambhasha, I would like to respectfully invite Dr. S. M. Nimali Solohokara. She will be delivering the effective use of Rasaushadhi in Shalya Tantra. Let me briefly introduce her to the podium, Madam. Dr. Nimali Solohokara, a consulting Ayurved surgeon in Ayurved General Hospital, Kurunegala, with 20 years of rich clinical experience. She's also actively involving in training of Ayurved medical officers and undergraduate students in non-communicable diseases, preventing programs, and Ayurveda surgical procedures. And Dr. Solohokara has many research publications in peer-reviewed journals to her credit, and Dr. Solohokara will explain the effective use of Rasaushadhi in Shalya Tantra. And moreover, she is also a visiting lecturer of postgraduate Shalya section of the Gampaha Vikramarachi University of Indigenous Medicine, and also she is a research supervisor of the Postgraduate Institute of Medicine Shalya students of University of Gampaha Vikramarachi. Madam, it's over to you.
Ayubowan, Namaste, have a nice day everybody. Respective Chair of the Forum, Madam Dangani Senasegara, and also my dear Sir, Professor Sayakara Jayawardena, and all the university lecturers, and also the Commissioner General of Department of Ayurveda, and all the guest speakers of India, and all my senior doctors, my colleague doctors, and all undergraduate students. First of all, I would like to convey my gratitude for Dhootapapeshwar company for inviting me to this valuable session as a guest speaker. Today, I am going to discuss with you my practical knowledge about Rasaushadhis used in Ayurveda Shalya Tantra. Here, we all are Ayurveda people, and I am not going to describe all the theories, but I want to show you and I want to discuss with you what are the correlations between drug and the diseases related to Ayurveda. Actually, my dear Sir, Professor, and all my guest speakers describe about the theories and all the fundamentals. Therefore, I am not going to discuss all these. Simply, I think Ayurveda is the most miracle medical system in the world, and also according to the definition, rather than the WHO definition, Samadosha Samagnisha Samadhatu Malakriya Prasannatma Indriya Manakittabiditi. Actually, according to this definition, you can understand other definitions rather than the other definitions of a healthy person. This is a vast definition and also analytically definition. I want to discuss with you a little bit about this definition. One whose dosas, it means the three biological dosas, mainly Vata, Pitta, Kapha, and the Agni. There are 13 types of Agni. Jatragni, Saptadatvagni, and Panchabhutagni, altogether 13 Agnis, and also the Malas. Especially, there are mainly three waste products. Then physical and physiological balancing of these dosas, Agnis and Dhatus and Malas, and also in the state of equilibrium, who has cheerful mind, intellectual, and sense organ. I want to discuss with you the correlation of diseases and drugs according to the Ayurveda, but I am not going to discuss with you in detail. Actually, according to Ayurveda, the role of dosya dusya sammurchana in vyadi utpatta. I think as you all are Ayurveda people, you know about this theory. Dosya dusya, according to the Ayurveda, a disease is due to dosya dusya sammurchana. Actually, dosya dusya sammurchana is mainly important for manifestation of disease, where sammurchana means intermixing of dosha with dosha, not only vitiated of dosas, but also samurchana means the intermixing of dosha and dushas means the vitiated saptadhatus. Finally, this particular combination of dosha and dusha is known as dosha-dusha samurchana, or according to Ayurveda, a disease or vyadhi utpatta. And also chikissa, according to Ayurveda, dosha-dusha samurchana vigatana means the disease or the chikissa or the treatments. In short, samprapti vigatana is also synonym with this dosha-dusha samurchana vigatana. According to Ayurveda, when we are treating diseases, mainly we are focusing breaking of pathogenesis or breaking of samprapti vigatana. In this stage, we are using dravyas or drugs. You all know samprapti, there are 6 stages, Sanchaya Prakopa Prasara Sthana Sanchaya Vakti Bheda. According to Ayurveda, Yakriya Vyadhi Harine Sachikissa Nigattite Dosha Dhatu Malanam Pasamrakutsa Eva Roga Hat. According to the definition of Bhava Prakasa, this is the definition of Chikissa or Dosha Dusha Samurchana Vigatana or Samprapti Vigatana. I want to discuss with this sloka with the what's the correlation between the dravyas or chikissa or with diseases. It's not important to discuss with you the importance of dravyas or drugs. According to the Ayurveda theory, according to the all Samhitas or the authentic textbooks, the dravyas or the drugs place in second prime important place in chikissa. According to the Chatuspada, it plays very important role. Okay, and to protect the health of a healthy person and to eradicate or eliminate the dosha-dusha samurchana, we use dravya or drugs. And my dear sir, Professor Sayakara has mentioned in detail, and other my Indian guest speakers also have mentioned very clearly about the Rasashastra and what is the importance of herbo-mineral formulations and its effect. Therefore, I am not going to discuss about Rasashastra, what are the importance of that Shastra. Now I come to my topic. According to my clinical experience, I'm an Ayurvedic surgeon. Out of 8 branches, Salitantra plays a very important role in our section. Not only in Salitantra, but also all the 8 branches of Ayurveda, according to our theories, according to our all of acharyas, the main root cause for each and every disease is ama. Roga sarvepi mandagna. Any kind of disease in the Ashtanga Ayurveda, the main root cause is the ama or ama. It means roga sarvepi mandagna. Therefore, not only in Shalitantra, but also all the other branches, first of all, we have to eradicate or eliminate the ama condition. It's a very strong theory according to Ayurveda. Otherwise, we can't go through, or we can't arrange, or we can't design a treatment line or Chikissa Sutra. Therefore, let's see. In Ayurveda Shalitantra, mainly there are 2 parts, Shala Karma or Parashala. Shala means the Yantra and Shastra. Parashala, you know, the Shara Karma, Agni Karma and Rakta Mokshana. In all the Ayurveda Shala Karmas, we conduct Pura Karma, Pradhana Karma and Paschat Karma. Especially in Pura Karma and Paschat Karma, practically we use lot of Rasaushadhis and all other drugs. Therefore, in here, I'd like to pay your attention. What are the drugs used to eradicate the main root cause? Main root cause means to eradicate or eliminate the armor condition and to eliminate the other signs and symptoms of diseases related to Shalya Tantra. When you are focusing eliminating of armor, there are we have to take so many steps. First of all, we have to eradicate the Nidana Parivarjana, means the avoiding causes. Each and every disease, according to Ayurveda, the best chikissa, according to all the authentic textbooks, is the Nidana Parivardhana. Best chikissa for all types of disease in Ashtanga Ayurveda, the best chikissa is the Nidana Parivardhana. We have to eradicate or eliminate the causative factor. Then we have to arrange drugs for Ama Pachana and Agni Deepana and Srota Shodhana and other external treatments like Panchakarma. Rasakalpa, now I'm going to discuss with you Rasakalpa for elimination of Ama. What are the Rasakalpas which is mentioned in Ayurveda to eliminate or eradicate for Ama condition? According to my practical experience as a surgeon, each and every disease in our Shalya Tantra, we have to actually focus to eliminate or eradicate the armor. Otherwise, actually, we can't conduct Shalya Karmas. In the process of Pura Karma, when we are preparing the patient, we have to actually arrange drugs especially to eradicate armor conditions. One of the most important Rasakalpas to eradicate armor is Agni Kumara Rasa. This medicine is mainly used in the management of diseases of the digestive system. As per Ayurvedic classics, Agni indicates, the digestive power. Actually, this drug is more effective in indigestion related complaints like abdominal colic, abdominal fullness, and all the related signs and symptoms due to armor conditions. We can use this Agni Kumara Rasa for, according to the Ayurvedic surgical related disease, all types of anorectal diseases. For an example, hemorrhoids, Arsha, Bagandhara, Parikartika, and Amlapitta, and all the anorectal diseases, and also all the Mutra Rogas and all the chronic types of wounds, and all the Ayurvedic surgical related disease in the primary stage, we can use to actually balance the Tridosha and balance the armor condition or vitiated armor conditions. We can use Agni Kumara Rasa, especially for indigestion, abdominal colic, bloating, vomiting, diarrhea. Lot of patients presents with nowadays they are complaining more and more some signs and symptoms, commonly fullness of the abdomen, and also the constipation, and also the abdominal colic. Nowadays, due to busy lifestyle, lot of patients in their busy lifestyles, they are tend to be consuming junk foods. It's very common nowadays. Due to these junk foods, they are present with armor conditions. Therefore, this type of armor conditions in OPD also, some diseases, especially Amlapitta, hemorrhoids, and Parikartika, constipation, And these types of patients, we can use Agni Kumara Rasa with the related dose. And also, let's focus what are the Ayurveda properties of this Agni Kumara Rasa, especially Deepana, Amapachana, and also Vatanulomana. This Agni Kumara Rasa has a property of Vatanulomana actually due to Bhavana with lemon juice. Okay? And also this Agni Kumara Rasa, especially we can use in Paschat Karmas in Ayurveda surgical procedures, especially for Bagandhara, as a rejuvenative drug or to enhance the immunity. Actually, most of the anorectal diseases, especially in like Bagandhara, they have a common sign. According to my experience, a lot of those types of patients are immunely debilitated patients. For an example, sometimes they are suffering from diabetic or really TBO, especially after COVID period. A lot of patients, they are present with as immunity debilitated patients. For those types of patients, as a rejuvenative therapy or as an antioxidant or as a rasayana drug, we can use this Agni Kumara Rasa. Then Agni Kumara Rasa we can use in the initial stage of these types of disease and the late stage of these types of disease as a rejuvenative drug. In the initial stage of the disease, we can use to eliminate armor condition, and the same drug we can use as a rejuvenative drug after the treatments. And there is another property, Srota Shodhana and Shulagna. Shulagna especially for Farinama Shula, means there are various types of pain due to GI problems. Agni Kumara Rasa, let's see what are the ingredients. Parada Gandhaka Tankana and Visha, Kaparada Bhasma, Shanka Bhasma and Maricha. And dosha predominance and Roga Marga of Agni Kumara Rasa dosha. The medicine is recommended for the treatment of Vata, Pitta, Kapha. It means all the three dosas. And Dusha especially. Dusha means the vitiated Saptadhatus, useful in diseases affecting to especially Rasadhatu. And especially keep in mind when we are prescribing these types of prasad drugs, we should pay our attention and make aware the patient what are the recommended diet and behavior pattern. Agni Kumara Rasa for other diseases, especially we use, I told you, to eradicate the armor condition, also the Arsha, Bagandhara, and Amachirna, Vistabdachirna, Amla Pitta, Grahani. According to the authentic textbook of Grahani, nowadays it's very common in our society. Most of the patients, they are suffering from irritable bowel syndrome. It means the collection of disease, ulcerative colitis, Crohn's disease, and other GI diseases. Actually, according to my practical experience, Agni Kumara Rasa is a very good and very important drug for ulcerative colitis and Crohn's disease. In Western people, actually they don't have a proper drug for ulcerative colitis and Crohn's disease. Lot of patients suffering from fistula, they also have these types of irritable bowel syndrome. It means Grahani type diseases. Therefore, we can use fistula when we are doing fistulotomy by using Shara Sutra. In their treatment process, we can use Agni Kumara Rasa in the initial stage of the treatment line and also after the Paschat Karma. And Udara Shula, Parinama Shula, and also especially in this decade, according to my practical experience, It's very common in CLCDs, means the chronic liver cell diseases. Actually, I don't know what's the real cause, but it's very common. I think the main cause is the junk foods or the janita foods. It means due to this busy lifestyle, they are consuming junk foods. Junk foods means, according to Ayurveda, foods consuming with dushi vision. Therefore, a lot of patients presents to our clinics with cholelithiasis, means the gallbladder calculi or the pittashmari, and also with fatty liver, various types of fatty liver stages. And the end of these fatty liver stages, they are suffering from what you call CLCD, the chronic liver cell disease. It's very common in our clinics. And after CLCD, it may convert into easily chronic carcinoma of the liver. It means the liver cancer. It's very common. And Dushtavrana, according to Ayurveda Shalyatantra, there are Sasti Vruna Upakrama. There are a lot of patients came with chronic wounds especially due to diabetic mellitus, and there are due to various causes. Actually, Western people, they are decided to amputate these lower limbs, but according to our system, it's not to do amputate. We have a miracle treatment, especially according to the Shalyatantra. For these types of patients also, we can use Agni Kumara Rasa. Next, let's pay our attention for Agni Tundi Vati. This drug also plays very important role for Ayurveda surgical related disease, to eradicate the vitiated armor conditions, and as a rejuvenative drugs. You can see, I'm not going to express what are the ingredients. You can see you can follow, you can refer what are the ingredients. There are a lot of ingredients. This traditional Ayurvedic medicine contains a variety of herbs and minerals that are thought to boost the digestive fire. It means the Agni, or the to eradication of the armor condition, which is necessary for proper digestion and overall health. Here is the list of green. You saw the ingredients of Agni Tundi Vati, and we can use. There are indications when you should have constipation, flatulence. It means the fullness of the abdomen, loss of appetite, various types of fever condition, improves digestion, intestinal worms, diarrhea, dysentery, cough. Actually, we can use this Agni Tundi Vati also for all types of anorectal diseases and all types of GI diseases in the initial stage and also the end stage as a rejuvenative drug. Guna Karma, according to the Guna Karma of Agni Tundi Vati, it also present with Deepana, Amapachana, Shulagna. Especially this is good for Parinama Shula. It means the pains where there is in the GI system, and especially Kapha Vata Hara Guna and Shota Hara and Agni Vardaka. We can use this drug for all types of Arsha patients, and Guddabransa also we can use as a rejuvenative drug, and also all types of Bagandhara. In Bagandhara patients, we can use this drug in the initial stage and also the Paschat Karma stage, and also the Grahani. According to the Ayurveda, the Grahani we can correlate with all types of irritable bowel syndrome diseases, especially ulcerative colitis, Crohn's disease and all that. And especially we can prescribe this drug for fatty liver, all the fatty liver stages. I told you nowadays it's very common in the society. I don't know the real cause, but according to Ayurveda we can explain this pathogenesis. Okay, then we can use for all types of fatty liver, stages grade 1, 2, 3 and chronic liver cell disease, and after that liver cancer also we can use this. And Pitta-Ashmari also, it's very common, it's cholelithiasis or gallbladder calculi. And Atmana, Kalina Malabadda. Kalina Malabadda means the chronic constipation, it also very common. There are due to so many causes, sometimes due to behavior and food pattern, and also sometimes due to anatomical variation, especially stenosis of the anal canal. Sometimes there may be tumors or cancers, so all that. And for this Kalina Malabadda tatta, we can use this Agni-Tundi-Vati, and also Parinama-Shula, chronic wounds. And Arogya-Vardhana-Vati, my dear professor also has mentioned, actually this Arogya-Vardhana-Vati, according to our field, this is a miracle drug, according to my practical experience, especially according to the Shalya Tantra, Ayurveda Shalya Tantra, lot of patients present to our clinics with various types of anorectal diseases, especially for Bagandhara. There is no permanent solution in the world for Bagandhara. The one and only solution is the fistulectomy by Shara Sutra, means by Ayurveda Shalya Tantra. Shara means one of Shalya methods. This Arogya-Vardhana-Vati, actually this is a miracle drug according to my professor. We can use this not only for Shalya related diseases but also all kind of diseases in nowadays, especially after COVID period. According to my practical experience, most of the people, they don't have a proper immunity. Then we can use all types of diseases for all the Vrana conditions and all the Mutra Roga conditions, Mutra, Ghata, Krachya and Aspari, and also all the debilitated diseases. We can use Arogya-Vardhana-Vati. Arogya-Vardhana-Vati has suggested its name due to Arogya for the good health. It also known as, according to the one of authentic textbook, Sarvaroga Prashamani is a synonym for Arogya-Vardhana-Vati. It means we can use this all types of diseases. It's one of miracles in Ayurveda. Arogya-Vardhana-Vati help to manage the digestive problem. It means we can eliminate the armor condition by this drug due to its Deepana Pachana properties, and also help to maintain the body weight, especially nowadays due to junk foods and due to lack of exercises. Obese is one of major problems in the world, not only Sri Lanka but also in the world. Arogya-Vardhana-Vati we can use to manage the weight and manage the armor and manage all the signs and symptoms to deficiency of immunity related diseases. Arogya-Vardhana-Vati is also widely used the skin disorder also due to Pitta balancing qualified. However, it should be kept in mind that scientific research on Arogya-Vardhana is very limited by according to practical experience due to Kalapurudha, Dekapurudha, Palapurudha, especially of Ayurvedic practitioners. We can use and we can say this is one of miracle drugs in Ayurveda, not only Shalya Tantra but also all the other Ashtanga Ayurveda Tantras. And you can see and you can follow or you can refer what are the ingredients here. According to seeing these ingredients, Haritake, Vibhitake, Amriki means Tripala, Shuddha Shilajatu, Shuddha Guggulu. And by reviewing these drugs, you can get an idea what is the real guna karmas and what are the properties as you all are Ayurveda people. Then especially Arogya-Vardhana-Vati we can use for constipation. Actually I told you this is a very common health issue for us as Ayurvedic practitioners. Actually we have to solve this problem by using our medical system. Constipation is due to mainly due to vitiation of Apanavata, and according to this ingredients of Arogya Vardhanavati, there are so many drugs in laxative properties. Therefore, we can use as for constipation patients also, and also we can use obese patients this Arogya Vardhanavati, and also for indigestion with arm condition we can use, and a lot of patients especially present in our clinics, Agni-Manda, or the anorexia, loss of appetite, constipation, fullness of the abdomen, all that. For all those types of patients in OPD and both in the residential patients, we can use this Arogya Vardhanavati, but it's better to use this Arogya Vardhanavati in the end of the treatment line, or the Shodhana Shamana Tarpana, it means in the Tarpana stage. I think it's better to use in Tarpana stage. And also all the types of irritable bowel syndrome patients, it means the Crohn's disease, ulcerative colitis, hemorrhoids, fissure in ano, fistula, all those types of irritable bowel syndrome diseases. And also all the types of malignancies. My professor also told you, we can actually, we can't give a permanent solution to stop the multiplication of cells, but by these types of drugs we can develop the quality of life. Actually it's very important. There are a lot of patients they present with and ask help to develop the quality of life, these types of cancer patients. Therefore all anorectal carcinomas, and especially in prostate carcinomas, we can use Arogya Vardhanavati to develop the quality of life. And also we can use this Arogya Vardhanavati as an immune booster, especially for diabetic patients and also TB and all that. And also all types of chronic GI diseases. And the next one is the Bolabhadrasa. It's one of very common drugs we are using in our clinics for especially for bleeding piles. According to Ayurveda also, according to Susruta, there are 6 types of Arsha patients. All types of Arsha patients, especially Raktaja and Pittaja, we can use Bolabhadrasa with proper diet regime and a proper behavior pattern. Okay. It aids providing relief from pain and discomfort from pile. Most of the hemorrhoids or the Arsha patients, they have pain and burning and PR bleeding. Then those types of patients, we can use Bolabhadrasa continuously 2 weeks. Sometimes we can stop within 1 week. Actually, after 3 days, most of the patients' PR bleeding may stop. Okay. We can use this Bolabhadrasa bleeding piles, and also nasal bleeding also we can use, and menorrhagia, dysfunctional uterine bleeding, hyperacidity. It's also very common diseases, amlapitta, or the heartburning, or the fullness of the abdomen, and also all types of liver diseases and spleen diseases. Most of the CLCD patients, their spleen also edematous. We can use these types of diseases, especially cholelithiasis, it means the gallbladder calculi, and also in the present it's very common in pancreatic calculi. I don't know whether you go through these patients. Pancreatic calculi, most of the patients who have gallbladder calculi, they have pancreatic calculi also. By the time this pancreatic calculi may convert into a CA pancreas, it's very common in this decade. It's actually, according to my practical experience, it's a new condition for me also. But Western people, they don't have a permanent solution for this, both the CLCD and the CA liver and the cancer of pancreas, and also the It's very common nowadays, cancer of gallbladder. Those types of diseases, we have solutions. Especially we can use Bolabadda Rasa and Arogavardhana Vati, Agditundi Vati, all that. Bolabadda Rasa especially has purified mercury, Suddha Gandhaka Paradaga. Glio Sattva means the Rasakinda, Tinosphoria cordifolia, ball resin, and salmalic bark extract. There are so many benefits of Bolabadda. Cures bleeding piles, bleeding disorders in women, helps prevent leukorrhea also. It's also a very common sign among the women, and also cures blood vision related pitta doshas, and also treat constipation and the hyperacidity, means the amla pitta, help in diabetic also, and also helps enhance immunity. Most of the people present with our clinics, lot of patients, they have diabetic. Sometimes we have to manage diabetic also. Then these types of drug we can use. And Chandra Kala Rasa. Chandra Kala Rasa used in Ayurveda treatment of especially in bleeding disorders. According to my practical experience, it's one of very good or the one of very miracle drugs for hematuria causing CA prostate cancer, or moderate prostanomegaly patients. They have hematuria sometimes. For those types of patients, we can use Chandra Kala Rasa. Most of the patients who have moderate prostanomegaly, actually they have erectile dysfunction, and they are complaining when they are urinate, there's a severe pain and burning and hematuria. Then in that stage we can use effectively, especially these types of rasa drugs, especially Chandra Kala Rasa, in the simply Shukrasmari or moderate prostanomegaly patients. Okay. Then Abrak Bhasma Tamra, purified and processed mercury, and Kutika Pippali, Glioi, the ingredients. This Chandra Kala Rasa we can use specially for hematuria, any kind of hematuria, as a complication of TURP patients. TURP means transurethric resection of prostate for prostatectomy, or the scraping of prostate in according to the Western medical people, they gone through a surgery called TURP. As a complication of TURP, those patients have hematuria. In that condition also, we can use Chandra Kala Rasa, and I told you most of the patients with moderate prostanomegaly, they have erectile dysfunction and Sukrasmari. In that stage also we can use this Chandra Kala Rasa. It means the painful ejaculation. The patients who have painful ejaculation with moderate prostanomegaly, we can use Chandra Kala Rasa. And also all types of dysuria due to mutraghata, kritcha and retention, and all types of menorrhagia, leukorrhea, burning cessation of farms and so on. Especially in postmenopausal syndrome in women, we can use this Chandra Kala Rasa to relieve the pain and the types of burning all over the body, and also burning micturition. Especially in Chandra Kala Rasa, Sita Guna, Rakta Prasadana, Rakta Stambana, Pitta Shamaka, Ratpit Shamaka, especially effective for Pitta and Rakta vitiated diseases. And also Chandra Kala Rasa, we can use all types of mutra gahata, kritcha and asmari, especially BOO conditions. BOO conditions means bladder outlet obstruction conditions due to trabeculated bladder wall and prostate enlargement, stricture formation, complications of TURP. Due to all that complication, there's a common stage bladder outlet obstruction. The symptoms and signs are dysuria, the pain, burning micturition, and hematuria and all that. In that condition also, especially for male, after 45, 50, lot of patients, they have these signs and symptoms, then we can use this type of rasa drugs. And urethral stenosis. Urethral stenosis as a result of TURP and also sperm calculi. Most of the moderate prostromegaly patients, they have sperm calculi or the suprasmary and all types of renal calculi. We can use this drug. And also Icha Bedi Rasa. I think all you have used this drug for chronic constipation, and also not only that property, it comes under Rasayana and contains Kajali and Jayapala major ingredients. Due to Jayapala, actually for chronic constipation due to various causes we can use, and also Kachali, it contains Kachali, then we can use for Rasayana therapy or regenerative therapy or HK, or we can use as an antioxidant. And it's a GI stimulant, and we can use this to eradicate the armor condition also, and also neurochemical formula, this Icha Bedi Rasa. Actually this Icha Bedi Rasa, we can rectify vitiated Agni. It means the Deepana, Pachana, Vatanulomana properties. Ingredients, Sinjaba officina Shunti, and also Maricha, Parada, Gandhaka, Tankan, and the main part is the Jayapala. And Krimi Kutara Rasa, especially we can use as an Ayurvedic formulation. This is prepared from the mixture of minerals and herbs. These are the ingredients, Ajamoda, Indrayavat. By seeing these ingredients, you can get an idea, Agni Deepana, Pachana, Anulomana, and Rasayana Guna also. The main action is the anthelmintic property, and also these herbs have antioxidants, especially Rasayana Guna, analgesic, and also carminative, astringent and antioxidant properties. We can use not only for worm infections, means the krimi roga, but also other properties, especially for Rasayana Guna. And Shankavati, you all know, and you have already experienced by using this Shankavati. It also helps to relieve various digestive disorders. We can use this Shankavati, especially in our OPD clinics also. It can relieve ulcers, hyperacidity, body acid, as well as debility. It works as stimulant, carminative, and effective digestive agent. Therefore, Shankavati, we can use all types of surgical related diseases, what you call the all Gudarogas and the dysuric conditions especially, and Amla Pitta, all that. And also Hajrul Yahud Bhasma. Actually, this is very important drug we can use in Mutra Roga, which has mentioned in Ayurveda, Gahata, Kricha, and Nasmini, dysuria, retention of urine, and the calculi type of diseases. This Hajrul Yahut is a mineral rock primarily composed of calcium, magnesium, and iron. Due to containing iron, we can use this drug as a rejuvenative drug, and also we can use this as an immune booster. Ingredients you can see Tripala, a combination of Tripala and Hajrul Yahut. The main ingredient also J-stones, means the Chandrakanti. Okay, stone is the main mineral source for this Bhasma. For all digestive properties, and fortifies bone health due to containing calcium and magnesium, and also detoxification. It means we can use this for all types of fatty liver stages, CLCD and CA liver condition, and also cholelithasis, it means the gallbladder calculi, and also the pancreatic calculi also. And Kapardika means the synonym as a Varatika Bhasma. Actually we can use this drug for all types of Mutra Roga, which has mentioned especially in Susuta Sanghita. In this drug, it has diuretic and antidiarrheic property. Especially we use for Mutra Rogas, all related signs and symptoms in Mutra Rogas. And Mukta Bhasma, also an Ayurvedic medicine, specially used to manage ailments associated with gastritis, the Amla Pitta and bloating and constipation. We can use this Bhasma. And also Swarna Bhasma. My dear Indian professor also has discussed what are the properties and what are the usefulness of this Swarna Bhasma. Actually, in our Shala Karmas, in the Paschat Karma especially, we can use Swarna Bhasma for all types of Bagandhara, Arshas, and all types of Mutra Roga, and especially for chronic wounds in the end stage of our treatment as Tarpana Chikitsa, we can use this Swarna Bhasma to enhance the immunity, not only relieve the signs and symptoms, but also to enhance the immunity. We can use Swarna Bhasma according to the proper dosage with diet regimes. It means according to the Patya. Actually, Swarna Bhasma acts as an antioxidant, immunomodulatory agent, nootropic and anti-rheumatic, antimicrobial and antiviral in addition. It means in communicable diseases also we can use this Swarna Bhasma and Vanga Bhasma. Vanga Bhasma drug contained mainly in tin. It means the lead oxide, 80%. It's very effective for treating urinary disorders, especially dysuria and the burning after urination, pain after urination, especially in Vata Jastila patients, means the prostate enlargement patients. They are suffering from severely with dysuric conditions. Then we can use this in the initial stage of our treatment according to Chikitsa Sutra. Ataurudan Prachaksa, Mutaroga Kramahitan, Snese do Panahang, Kramastotra Vastyak, all the Mutaroga, Mutragahata, Kricha and Asmari, the common Chikitsa Sutra we have, we can use this. And Sutta Sekara Rasa also we can use, and you all have used Chandra Prabhavati as the Shodhana, Shamana, Tarpana. In these three stages we can use Shodhana stage also we can use Chandra Prabhavati, Shamana stage also we can use Chandra Prabhavati, and Tarpana stage we can use Chandra Prabhavati. It's very good drug, rasa drug for all stages in our Chikitsa Sutras as a rejuvenative drug, not only as a purification drug but also rejuvenative drugs. These drugs clinically, according to my experience, are very powerful and very miraculous drugs we can use in Shala related Ayurveda drugs. Thank you.
Thank you very much, Madam, Dr. Nimali Solohokara, for explaining us the effective use of Rasaushadhi in Shalya Tantra. So, ladies and gentlemen, to felicitate Madam Solohokara, I would like to respectfully invite Chair of the 7th edition of Sri Dhootapapeshwar Rasaushadhi Limited, Dayangani Senasinghe. Madam, please come to felicitate Dr. Nimali Solohokara for her effective presentation. Can we have a round of applause, ladies and gentlemen, to Dr.